Welcome to the webinar, How to Attract and Retain More Patients. In this webinar, we will explore how to give patients reasons to refer their friends and family, which really starts by delivering a consistently great patient experience. We will then cover how to implement an effective internal marketing program. My name is Mike Smith, and during this webinar, I will pull from my experience of coaching dentists and teams. I will also pull from the book I wrote, The Path to Greater Dental Practice Success. I have the good fortune to work for Fluence, an innovative dental CPA and consulting firm based in Portland, Oregon. And we are proud to be part of the Academy of Dental CPAs, a like-minded group of CPA firms from across the country that specialize in helping dentists. Well, now that we've completed our introductions, we'll start our webinar by looking at the patient experience. The quote by John Maxwell really sums up the importance of the patient experience. People don't care how much you know until they know how much you care. Now, you may think that's obvious. Of course, we show patients how much we care. However, you may not realize that there are things that could be working against you. Let me share with you a worst case scenario of what could go wrong with the patient experience. So a patient comes to your practice, walks in, but unfortunately no one greets that person. So the patient sits down and looks around for a magazine, but they're all out of date by at least a year. And this is a practice that prides itself on being state of the art. The patient then stands up and looks at the beverage stand. The coffee's out. There's no water for tea. There are no cups. The patient then decides to try the restroom and unfortunately finds the restroom to be pretty much unclean. What does that say about the overall cleanliness of the practice? So then the patient sits down and waits for his 1 o'clock appointment. 1 o'clock comes, 1:05, 1:10, 1:15, 1:20. No one has said anything to that patient. What do you think his state of mind is going to be when he finally reaches that operatory? How likely is this patient to accept treatment, to refer friends and family, or maybe even to come back? You see, this is why the patient experience is so important for effective internal marketing. You cannot expect to attract and retain more patients if you do not consistently have a great patient experience. And that is why we are going to look extensively at what you can do to make your patient experience even better. The first thing that you can do to create a positive patient experience, to create an environment where people are wanting to refer their friends and family, is to greet patients by name. Dale Carnegie once said, if you want to win friends, make it a point to remember them. If you remember my name, you pay me a subtle compliment. You indicate that I've made an impression on you. Remember my name and you add to my feeling of importance. You want to add to your patient's feeling of importance, that they're more than just a chart, by remembering their name. That's the first thing you can do to create a positive patient experience. Make that extra effort. Next, make sure you have a comfortable waiting area that's clean and modern and personalized. And that means that you are going to have to pay attention to this throughout the day to ensure that the restroom is clean and as spotless as possible. That if you have a beverage area, that beverage area has been refreshed. That if you're promoting that you're state-of-the-art or up-to-date in dentistry, which pretty much everyone is, that you do not have magazines that are years out of date, or that you're not running a video loop that looks like it's from 20 years ago. In addition, consider how you can personalize your waiting area. For example, do you have the need for puzzles or games for kids? Can you add decorations at certain times of the year to make it look more inviting? Or do your patients want certain hot or cold beverages that you could add? Think about that. How can you make your waiting room even more comfortable? Because you want patients to really feel welcome when they come in. The next component is an absolute must for practice growth, and that is you have to run on time. In fact, this topic is so important, I have a separate webinar just about this. Running behind kills practices. It kills practice growth. Now, it will happen even in the best of practices from time to time, and you need to make sure that you have a mechanism for keeping patients informed. In the example I gave a few moments ago, that patient sat there with no one letting him know why the practice was running behind or when he could expect to be seated. So hopefully you have everything fine-tuned to where this rarely happens. And when it does, make sure patients are informed about when they can expect to reach the operatory. The next thing you can do to create a positive patient experience is to enhance patient comfort. Most practices do a great job with this in the sense that they have some type of offering for patients, whether it be a blanket or a pillow or headphones or something to make patients feel more comfortable. But the other part to this that is so important is to pay close attention to the body language of your patients. You have people that will come in, sit in the operatory, and originally tell you that they do not need the blanket or the pillow or whatever it might be. But 5 minutes, 10 minutes into the appointment, if you're paying attention to their body language, you can clearly tell that that answer has changed. So make sure you bring it back up. And that will really show patients that you're paying attention to them and that you care. Next is all about customer service. Answer questions and recall or return calls promptly. If you need to research something or look something up, which is often the case, let patients know a time frame they can expect to hear back from you. And always, always follow up. Because think about places where you have been, where they've had poor customer service, where you needed an answer and someone did not respond. You do not want your practice to be known that way. Instead, you want to be known as a practice where if someone has a question, you will follow up and patients know they can count on you. That is a major reason why patients will refer their friends and family to your practice. Next, make sure that you're resolving mistakes and misunderstandings. There's a quote by Donald Porter of British Airways, and he said, "Customers don't expect you to be perfect. They do expect you to fix things when they go wrong, and things will go wrong." So remember, your patients are not expecting perfection. Instead, what they're expecting is that you're going to resolve the mistake or the misunderstanding in as timely a manner as possible. So I want to ask you, as you consider the patient experience, what can you do to make your patients feel even more valued? How can you ensure that this is occurring on a regular basis? Ensuring that your patients feel valued starts with preparation. And there's probably no better way to prepare for the day and for your patients than through an effective morning huddle. Morning huddles allow you and your team to get on the same page. They allow you to troubleshoot issues before they become issues. They allow you to learn information about patients that you can use to connect with them in an even deeper way. And morning huddles help you keep on track with internal marketing. So let's now look at huddles and how they can help your efforts and improve your efforts for making patients feel valued. So what makes for a successful morning huddle? First of all, the huddle is used to troubleshoot the schedule. When you're troubleshooting, you're looking for when can you schedule an emergency who may come up? Does your hygiene team need help at some point during the day with charting? Are there bottlenecks you need to discuss about and work around how to overcome those so you can stay on schedule? And if there's an opening in the schedule coming up in subsequent days, remind everyone so people can work together as a team to fill that. Huddles are ideal times to talk about goals, whether they revolve around production or internal marketing. And I think probably the most important part of a huddle is discuss key information about patients. If someone is new to the practice, how did they find the practice? If someone has been resistant about scheduling treatment, what is your plan to help motivate that person to schedule? Maybe also there's certain personal tidbits to know. Maybe a patient has a new job. They were recently married, or they went on vacation, or had some other thing to celebrate in their life. It's a great thing to know as you go in to meet people. And patients are really impressed. Just like John Maxwell's quote from a few slides ago. By knowing this information, you really impress people because you show that you care. Well, when you have the team on the same page and you consistently can give a great patient experience, you're now ready to start adding more patients. The next step is to get the word out about the fact that you're accepting more patients. Why is it that you have to get the word out that you're accepting new patients? Shouldn't your patients already know that? Well, when your patients come into your practice, they look around and they see other people in there. They know that you're busy, at least to some level. They also consider their experiences with other providers, some of whom may not be accepting new patients. So your patients do not automatically know that you are accepting new patients. In fact, when people call, your front office team will tell you one of the first things a potential new patient will ask is, are you accepting new patients? That is why it is so important that you let patients know you are accepting new patients and you extend an invitation for them to invite their friends and family into your practice. However, whenever I work with doctors and teams on internal marketing and asking for referrals, they are understandably nervous. What we're going to talk about next is how to overcome barriers to asking for referrals, barriers that get in the way of an effective internal marketing program. The first common barrier to internal marketing is that asking for referrals feels awkward and unnatural. But I really like what Tom Fishborn had to say about marketing. He said the best marketing does not feel like marketing. What we need to do in order to overcome this barrier is to overcome this idea that it has to feel like marketing or like you're trying to sell something. It should never feel forced. And that's something we'll talk about, how to make sure that when you're asking for referrals, you do so in a way that is natural for you. The next barrier that comes up is the fear of offending someone. So not only does it feel a little awkward to ask for referrals, but there's this concern that a patient's going to think you're trying to be pushy or salesy. Well, I want you to put yourself in the patient's shoes for a moment. Let's assume that you're going to a provider who you really like. You appreciate the doctor and the staff. And the day comes when they ask you to refer your friends and family. How would you feel? Well, most of us would take that as a compliment. You appreciate coming there. You like the service they provide. And so when you're asked to share this with someone else, it feels like something you want to do. Because if we can turn some of our friends and family onto a great provider who we appreciate, it also makes us look good. So if you as a practice are providing a great patient experience and tremendous service for your patients, then it becomes much easier to ask. You're simply sending an invitation, and people are happy to pass that along, especially when they appreciate what you do. So it's not about being pushy whatsoever. It's about offering an invitation to your patients. So now let's look at when and how do you ask for a referral. Well, the best way to ask for a referral is when you get an opening through a compliment. Compliments are ideal for this. So a patient may say, I feel so much better, or the crown looks great, or I really appreciate the doctor and team. I really like it here. Those are wonderful opportunities to ask for a referral. And keep in mind that these opportunities come from creating a great patient experience, which is why we began the webinar looking at that. You have to have that as your fundamental. It has to be fundamentally in place because it drives everything with internal marketing. So when you are given that compliment, then there's your opening and your opportunity. So here are a couple ways that you can say this. Respond, for example, with thank you. Let me give you our card. Please tell your friends and family about us. Or thank you. We'd love it if you tell your friends and family about us. Or if they're as nice as you, please send them our way. There are a number of ways that you can respond. Think about what's going to be the best for you. The shorter, the better. And what I've found through the years is practices tell me, dentists and teams tell me that when they can give something to the patient, a business card or whatever it may be, it's easier for them to ask for that referral. It makes it feel more natural. So consider that in your situation. Patients give you that compliment and then ask for that referral. So that's one of the ways. The second opportunity to ask for a referral would be after each hygiene visit. Hygienists are in a great position to ask for referrals. Now, when I say this I talk to hygiene teams about this, they don't necessarily initially jump up and down about the idea that they're in this great position, but you really are. Patients have a great connection with their hygienists. And naturally, at the end of the visit, hygienists are giving patients something. Typically, there's some type of a goodie bag that has toothbrush and floss, et cetera, that's going in there. So it's very easy then to put a business card into that bag. And to let the patient know, I've put a business card, one of our cards in your bag, please share it with a friend. Or we're always looking for new patients like you. That's why I put a business card in your goodie bag. It's really that simple. And by doing that, you are reminding patients that you are accepting new patients. It's a really critical thing to make sure you're reminding them about. I'll now share a story of why it is so important to make sure you are asking. One of the teams I worked with a few years ago was going through this process of implementing internal marketing. And I was there doing a practice observation where I could hear what was being said in the operatories without the patients seeing me. And a hygienist who was a little shy but very determined knew I was watching, so the pressure was on, if you will. When she ended the appointment, she pulled out the business card, put it in the goodie bag, and she did a fantastic job. She told the patient, "We really appreciate having patients like you. Please share this card with your friends and family." Well, this patient pulled the card out of the goodie bag and he said, "I'm really glad you gave me this. There's a new guy who started at work. I'll make sure he gets it." Now, this really drove home this point of asking for referrals to this team and to this hygienist. You see, here was a patient who was sold on the practice, who really liked his hygienist, but yet he wasn't thinking about telling this person at work about coming to see them. It wasn't until the hygienist reminded him that they were accepting new patients that the lights went off and he said, I'm going to share this card with this new guy who started at work. This is why it's so important to extend this invitation to patients, to remind them that you are accepting new patients. Well, not only does the clinical team have opportunities to ask for referrals, the front team does as well. Front teams will tell you sometimes patients save their compliments until they reach the front, and then they brag about the hygienist or the doctor or the assistants. And this is a great opportunity for the front team to say, "Thank you for the compliments," and then get a business card and say, "Here, please share this with your friends and family. We really appreciate it." So every member of the team has an opportunity to ask for referrals. Another opportunity, which you may not think about, is when a patient finishes his or her treatment plan. This is a great opportunity to ask for referrals. I saw this in action several years ago with working with a very proactive practice, and the doctor was really wanting to challenge himself. So he said to the patient, for example, "John, there's nothing else left for us to do on your treatment plan," which is great news outside of preventative care. "However, I need your help staying busy. Please invite your friends and tell them about us." And it was done in a really nice way. It made the patient laugh. And I've shared this with lots of practices since. If you have a patient who's completed the treatment plan, also look at that as an opportunity to ask for referrals. A common question that comes up is, how often can you ask for referrals? Well, the last thing you want is for your patients to feel like they're going through a gauntlet. Every time they come in, they're being asked by multiple people. On average, asking the same patient once, maybe twice a year is plenty. And a good way to track this is within the notes section within your practice software, not the patient notes, but in one of the other sections. And I encourage you to talk about this as a team to decide how you're going to keep track of who you've asked. Another important aspect of internal marketing involves online reviews. Most of us will always check an online review before we buy anything. And particularly right now, and probably for the foreseeable future, Google reviews are possibly the most important. It's really critical then for you to be asking patients to leave you these reviews. I encourage you not only to ask for referrals, but also make it a point to get your reviews going. Ask patients for those reviews. Oftentimes you can do this through your patient reminder system. So after the appointment, send them a reminder, ask them to leave you a review, ask them in person. Now, one of the things that comes up when you start looking at reviews is once you receive a certain number, eventually you are going to get a negative review. And this can be devastating and understandably devastating for a practice. None of us wants to hear that something negative occurred, especially with all the effort that you put in with your patient care. But I want you to keep in mind that a negative review is also an opportunity to handle that review effectively. In particular, when you do get a negative review, you want to come from a place of empathy. You do not want to argue with the person who left a review, regardless of how ridiculous it is. The most effective response is to invite that patient to contact the practice so you can discuss whatever challenge it was that they had. When patients see that and that you're not arguing, it really stands out. In addition, one of the best things you can do for negative reviews is to bury that review with more positive ones. So this is another reason. Make it a goal to get 20 and then 30 and then 50 and then up to 100 and beyond reviews. Look at other practices around you to see how they compare to yours. If you have 4 reviews, for example, and other practices around you have 50 or 100, when patients are looking, who do you think they're going to be more inclined to call? So online reviews are another critical part of your internal marketing program. I encourage you to emphasize those as well and to ask patients to leave you reviews because they're not automatically going to do it. Well, we've covered a lot of important points in the webinar. Let's review the key ones. First, remember that internal marketing is all about creating a great patient experience. Why would someone refer their friends and family to a practice where they do not receive a great patient experience? So a consistently positive experience means you greet patients by name. You make them feel comfortable. You consistently run on time, and you have just excellent customer service. And one of the best ways to ensure that you're on the same page regarding a great patient experience in internal marketing is to have an effective morning huddle. It's important to keep in mind as you think about internal marketing that most patients are unaware that you accept new patients. That's why you need to ask. Ask for referrals, especially after patients give you compliments, following hygiene visits, or when patients finish treatment. And remember, patients are going to give you compliments because you give such a great patient experience. And make it a goal to increase the number of online reviews that you have. Focus specifically on Google reviews. Well, attracting and retaining more patients, it certainly requires commitment. Commitment to customer service and patient care, in addition to commitment to challenging yourself to stretch a little bit and invite patients to refer their friends and family. Well, as you're on this path, please let me know how I can be a resource for you. I encourage you to also check out my book, The Path to Greater Dental Practice Success. Well, I wish you all the best as you work on increasing your patient base. With the right level of commitment from the doctor and team, you can attract and retain more patients.